Good afternoon, everybody. Welcome to our unanticipated press briefing with regards to the announcement that was made today by Governor Cuomo that fans will be able to attend the first playoff game that the Buffalo Bills will have in 25 years, the weekend of January 9th or 10th. I'm going to go into some of the details and part of what the discussions that I was involved with over the last few days. But I first off want to thank Governor Cuomo and his team with Commissioner Howard Zucker and Budget Director Robert Mujica for the effort that they put in. I've had multiple conversations with Budget Director Mujica with regards to the process as it was moving along. I also want to thank the Buffalo Bills organization, specifically Terry and Kim Pagula. They wanted to make this happen for their fans and for the team. This, I do not believe, will be a moneymaker for the football organization, but they want fans to be able to enjoy the experience of the first playoff game that Buffalo Bills will have at home in 25 years. And we know we also want Josh Allen and the rest of his teammates to see some fans in the crowd. So I want to thank both organizations from New York State as well as the Buffalo Bills for the efforts that they made to make this happen. As I said recently, I really didn't think there was a way that the county could participate in providing the resources necessary to test thousands of fans, and that is what isn't going to happen because the county will not be involved in the testing of fans. For that matter, the state of New York will not be involved in the testing of fans. Testing of fans who acquire a golden ticket, so to speak, will be done by BioReference Laboratories, a private entity. I know there's a lot of questions about how do we get more information about acquiring tickets as well as the testing protocols that are in place. So I'm going to ask my team to put on the screen a link which is at buffalobills.com/tickets/tickets-FAQ. It's on the screen, hopefully in front of you. And it has the frequently asked questions, which are really being asked right now with regards to what it entails to purchase a ticket, how many individuals will be able to purchase a ticket with regards to the pods that are available, and the surcharges that go along with it. As I noted, during the last week or so, I've had multiple conversations with the Buffalo Bills organization as well as New York State in regards to the plan as it was being approved and formalized. This is a good plan that will ensure that every individual who attends the game passes a traditional PCR test. As has been informed to me by the Buffalo Bills organization, these are not your rapid tests that we normally use. These are normal swab tests that will then be driven from a swab site, testing site, in Orchard Park that will be run by BioReference to BioReference's labs in New Jersey. The first tests will occur no earlier than 72 hours before the actual game time. It is unknown yet what day the Bills game will be played, whether it will be a Saturday or a Sunday. But it will be the 9th or 10th of January, and it would be 72 hours before game time. I do believe that the testing will take multiple days, probably 2 days to do, because of the size that are going to be allowed in, which is a little over 6,000, 6,200 or so, 6,700 in total when you take into account some of the other individuals that are in this facility, that there will be a certain number of days that are going to be necessary to do the testing. Erie County Department of Health will not be putting any staff or, for that matter, resources into the actual testing. The testing, as you're seeing on the screen, if you can see it, I should say tickets will be available starting December 31st and January 1st on a first-come, first-served basis to season ticket holders. And then if there's additional rounds, those will come later. The ticket prices will vary, and I would suggest you can see everywhere from $65 a ticket to $330 a ticket, plus testing and parking fees. Every person will have to pay a $63 fee for testing And then there is an $11 charge for parking. Even if you don't come in your own vehicle, you will still have to pay a ticket for a parking fee because they're trying to avoid the direct contact between individuals that normally would take the money at the parking lots. There will be no tailgating. It was one of the key things that we were pushing for, as well as New York State. There will be no tailgating at all with regards to the lots that exist. In other words, you pull into the lot, then you immediately have to put your mask on once you're at the game, and you will walk in, and there's a protocol that will be in place to ensure that every individual who enters the facility is an individual who is already tested and passed the testing by getting clearance saying that they had a negative result. It was not positive. It is a very complicated process, and I commend the governor and his team for putting in a very complicated process that will ensure that the individuals who are being tested are negative on the day of at least the test. There's always issues with regards to what could potentially happen afterwards, but this test will be performed by BioReference. It will not be performed by New York State. It will not be performed by the Erie County Department of Health. It will be a drive-through testing clinic, so to speak. I believe it's going to be one of the largest drive-through testing clinics you're going to see because they're going to have to get thousands of people done on a daily basis if they're going to do and have over 6,000 fans in the stadium. I suggest all go to buffalobills.com/tickets/playoff-tickets-FAQ, which is the website I have on the screen to show how and why and what needs to be done for an individual to get actually into the stadium. So just because you are lucky enough to get a ticket, you will not necessarily be able to do anything with that ticket unless you actually are tested by BioReference. No other testing site is acceptable. It has to be done at these BioReference drive-in clinics, in which the more information will be provided by the Buffalo Bills after an individual has acquired tickets. There are pods that are available. If an individual tests positive, they can get a refund of their ticket price and their parking fee, but not the test fee. If you've bought a number of tickets as part of a pod, you can then cancel that. There will not be a second round. There will not be enough time to do a second round to open up those tickets to others in the general public. Those tickets are not transferable. It's one of the keys that we wanted to ensure is that everyone who enters that stadium had received a negative test. Erie County will be active with regards to our normal game day operations, providing security and operations at the facility. That includes the Erie County Departments of Homeland Security and Emergency Services, the Erie County Department of Public Works, the Erie County Health Department in a limited role with regards to EMS insurance, and of course the Erie County Sheriff's Office, which is actively involved no matter whether there was any fans or 70,000 screaming fans. The information with regards to how this process will be going forward is much more detailed. As I noted, it is on the Buffalo Bills website, and I suggest all who are interested that are season ticket holders and will be putting forth an opportunity to purchase those tickets actually go to the website. It is going to be a very, very dedicated process to ensure that everyone who enters is safe, as the governor noted. We are going to do our best to ensure that each and every one of the community members who actually have an opportunity to enjoy the football game are enjoying in a safe manner by working in our operations as we always do to protect those who enter the facility. It's going to be like a football game unlike any other. There will be some fans in the stadium, and I'm glad that some individuals are going to get an opportunity to enjoy the first home playoff game that our Buffalo Bills have had in 25 years. We have a tremendous team. Truthfully, the best team I think I've ever seen, maybe even better than the Super Bowl years. We want them to go far, and some of our fans are going to have an opportunity to watch that first divisional or wild card game, I should say. And if we're lucky enough to win that, then go on to the divisional round. It is going to be a very, very complicated process, but one that in the end will ensure the safety of those who enter the facility. I wanted to note and come on because there have been criticism, why would the county dedicate resources for testing and when we really are using tests for other purposes in the community, to note that, once again, the county will not be dedicating any resources, neither tests nor for that matter staff. This will all be done by BioReference, the private laboratory, under an agreement with the NFL, and the individual will have to pay the $63 surcharge, which goes towards defraying the costs associated with the test. We will be involved on the game day operations, but Erie County will not be involved with regards to the testing operations, other than if an individual does test positive, that will go into our system, and our contact tracers will then be involved with contact tracing that individual as we normally would with any individual who tests positive in Erie County. I am happy for our fans that have an opportunity to attend the game. I'm happy for the team and the team players who've put in a tremendous year and now have an opportunity to have some fans. It is not a perfect system. Not everybody is going to be happy because they want as many people as possible in the stadium. But as I said earlier in the year, we thought we could get 7,000 people, or about 10% of the stadium, in safely. And this project and this plan that's been moved forward with New York State, by testing all of the fans, by testing the concessionaires, by testing those who have direct contact with the public, will ensure the safety of individuals. With that, I will open it up to questions, and we'll start with, first off, why don't we start with Jimmy Vilkeen of the Wall Street Journal. How are you, Jimmy?
Good, Mark. Thank you very much. One thing that obviously came up was you don't want tailgating. How will the county be working to ensure that beyond the parking lot that gatherings don't occur and that this doesn't turn into a spreading event?
That is a legitimate concern, and it's a conversation I had with Budget Director Robert Mujica, as well as our Department of Health and others. Actually, last week I ordered our departments to start putting together the plan so that we could be ready if fans were allowed to go into the stadium for the first playoff game. The town of Orchard Park issues permits to the private lots so that they can park. It is my understanding no permit has been issued so far for any private lot. And it is, as we noted, every fan is going to have to pay an $11 parking surcharge whether they park or not. So in stadium lots will be dedicated to handle all of the fans that are entering the facility. So first off, I do not believe there's any reason why a permit should be issued to the private lots because this decision was made for all the fans to stay on the public lots. And if they do not have a permit to allow individuals on their private lots, then there can be no tailgating on those private areas. So it will be in the hands of the Erie County Sheriff's Office as well as the Orchard Park Police Department to monitor that on game day. I know it's going to take some effort, but it is very important that people follow the rules. And here's the number one reason why. And I'm glad you asked the question because it was something that Robert Mujica and I talked about today. If there's lots of tailgating on private lots, New York State will not allow a second game if we make it to the divisional round where fans will be allowed in. They're going to be watching. So if fans think, hey, it's great, I'm going to go party and tailgate at a private lot, I'm just going to avoid the public lots that are controlled by the Buffalo Bills in Erie County, well, you're going to basically ensure that in future weeks there will be no fans in the stadium because it was one of the key protocols that was noted to me today. The budget director as well as the health commissioner, that was a big concern for them. It's a big concern for us because we've said tailgating and small gatherings like that is a concern. So I do not believe that the private lots will be able to get a permit to operate, and even if they did, by tailgating, they're basically going to ensure that for future weeks, no fans will be allowed in future games, and none of us want to see that. When it comes to the public lots, people can pull in, and that's basically it. You can sit in your car until such time as you walk into the stadium. You got to have a mask on from the time you leave your car all the way into the stadium at all times unless you're eating or drinking. There will be no sit-down concession areas. So people who are concerned, I did have a conversation with multiple people on that. So there will be no sit-down areas, club seating areas where people can sit and eat. It is prohibited right now as an orange zone in Erie County. So the only places that people are going to be able to sit and eat is their own seat. So it's a pretty complicated formula with more information coming. But when it comes to the parking, I'm really hopeful that the fans understand that they've been given an opportunity to enjoy the football team live in person. And right now, We want to ensure that that continues for as long as possible. And if people abuse it, then I'm fairly confident New York's going to pull the plug on this and say, even if we get to the divisional round, the fans will not be allowed. Next question, if she's on, Carolyn Thompson from the Associated Press. If not, we will go to WBEN Radio. Michael Desmond, WBFO.
Yeah, Mark, will you only open parts of the parking lot?
Yeah, not every parking lot is going to be open. There's going to be designated areas. We have parking spaces, truthfully, for about 11,000 cars. And we're talking about if every individual drove separately, we're certainly talking less than 7,000 vehicles. So there are going to be designated lots. It'll be noted to the fans who actually get the tickets and pass the test where they'll be able to park. Buffalo News, Maki Becker.
Hi. Two questions. One, is there any change to like the concessions? Like, is beer allowed? And then also, are you personally going to go?
I do not believe I'll personally be going. I'm not a season ticket holder that's got priority, so I won't be having a ticket.
Okay.
I hadn't planned on it. And concessions will be allowed, but as I just noted, the concessions will not be the kind where people can stand and mingle. They're going to have to buy the food and go back to their seat. There will be no seating. The seating areas, if they will be taken away, so people cannot sit there and sit down and have a drink and have a food like they would in a restaurant, because we're in an orange zone and it's prohibited right now. So that was a direct conversation that I've had with Bill's organization representatives as well as the state. People will be able to buy a hot dog, they will be able to buy a beer, but they're going to have to take it and sit at their seat. Spectrum News, you're welcome. Anybody on from Spectrum News? If not, WGRZ TV.
Hi, Mark. It's Leanne here.
Hi.
Just a quick question for you about the testing process. I know that BioReference will be handling the testing, but do you have any details about exactly where this testing operation will be taking place? Will it be at the stadium itself? It will be for the full 72 hours, or could it be longer that the drive-through operation will be held? Just, can you give us some more details about the operation?
It will be, people will have an opportunity once they've purchased their tickets to choose a particular time for testing. The operation will be at the stadium complex in the parking lots adjacent to the stadium. It will be a fairly large operation. I've heard there are going to be many, many lanes. It's going to be a drive-through testing operation, potentially up to 20 lanes. So the people will not have to leave their cars. They will be swabbed in their vehicles. They will drive through. They will not get immediate results, is my understanding. I've been told the tests will be then, the swabs will be taken to BioReference's labs in New Jersey. They'll be driven to New Jersey, in which then they will be put into a traditional PCR machine. It will take a number of hours to do those tests. That's the best type of test to prove or to confirm whether somebody has COVID-19. So this will not be something where someone can go to another testing site and say, hey, I was tested by Erie County, or I was tested by a private entity elsewhere and I passed, which also brings up an interesting thing. If you take a test and you fail, you do not get a second chance because there will not be enough time. You do not get a second chance. So if an individual was COVID-19 positive in the recent past, it is not unheard of for an individual to then go get a test and come up positive because they have a dead virus in their system. So it's possible individuals who may have recently had been COVID-19 positive but are no longer symptomatic and may not actually have the live virus could theoretically test positive because they have the dead virus in their system. They will not be given an opportunity to enter the facility. If it comes up positive, they will be prohibited from entering the facility. And as we noted, the tickets are non-transferable. I think I noted that, but the tickets are non-transferable. So you cannot not then sell the ticket to someone else. The ticket is specifically for that individual. If the individual fails, basically the ticket is destroyed. So the person will not be able to transfer it to someone else, nor allow anyone else into the stadium with the ticket. So the testing will be comprehensive, on-site. It will be, truthfully, as I said, one of the largest testing operations we've probably seen in this community. And the best part about it is the county will not be expending any resources and the state will not be expending any resources. The resources are being paid for by the ticket holders and the Buffalo Bills. Mr. Pagula and Mrs. Pagula are putting a lot of money to allow fans, even a small amount, back in the stadium. I don't think they're going to make any money on this. I think they're going to lose money on this. But they want fans to enjoy the experience. They want our players to play in front of some of the fans. It's been done elsewhere, as we know. There's been no major pod outbreaks that we're aware of at other NFL locations. But we are understanding that there's always risk involved, and with this plan, it eliminates the most risk possible. Next up, is there anyone on from Channel 4?
Hey, Mark, it's Chris.
Hi, Chris.
The governor said the governor said he wants to see how the first game goes before deciding on, if the Bills host a divisional game, before deciding on that. Is it realistically enough time to conduct all that contact tracing and then bring in another, 6,700 fans to test them before a divisional game to make that decision in that short of time?
Well, it certainly is enough time to test the individuals. Afterwards, they certainly would be contacting these individuals to find out if there are any additional symptoms that they're having, if there's something that may have popped up. We're not going to be involved in that. We would be involved in contacting, tracing individuals who test positive during the tests. So if someone tested positive, that test comes to the Erie County Department of Health. We talk to the individual, we contact trace them. We're not going to be responsible for the calls afterwards to the people who actually attended the game. We also, as I noted earlier, this is not a set in stone for the rest of the season, as you noted too. It's just a test for the first game. It's possible if things go bad, if there's crazy tailgating in parking lots. I fully expect that the state will say you had your chance and you blew it. You're not going to get another opportunity. So I think it's truthfully in everyone's best behavior to follow the rules and give people an opportunity to enjoy the first home playoff game in 25 years. I've attended playoff games in the past at home. They're fun. They're a lot of fun when the Bills are winning. It's not going to be the same because there's not going to be tens of thousands of people in the stadium, but walking out of a football stadium when the Bills have just won a playoff game is a fantastic feeling. I experienced that back during the Super Bowl years. And the more people who can experience, the better. But if people don't follow the rules, if they're not wearing a mask in the stadium, they're going to get thrown out. If 1/4 of the people stop taking their mask off in the middle of the game, I guarantee you there will not be a game the following week. If there's parties and tailgating in these private lots, there will not be a game the following week. So people need to be on their best behavior to enjoy it. And if they don't, they're going to ruin it for everyone else. Channel 7, WKBW.
Hi, Mark. It's Ashley Rowe here.
Hi,
I want
Ash.
to just broaden this out to more of a macro level beyond the stadium and the private lot. We have seen now 2 weeks in a row thousands of fans standing together for hours to greet the Bills. Now, I know this is a home game, but we also know Bills fans and how they like to celebrate. What were the conversations between you and New York State and the Bills and others in the room as you weighed that consideration about the, frankly, thousands of fans that were at the airport?
It was a real conversation. No one was happy about it because we realized there's a distinct possibility. Actually, the odds are such that because there were so many people there that there were some that probably were COVID-19 positive and didn't know it. We've been lucky. Our numbers have gone down with regards to new cases. We've seen a little spike in hospitalization over the last 2 days, but our numbers with regards to new cases have continued to go down. We've pretty much had 3 weeks of declining numbers. And if the numbers were to go up, I wouldn't feel that the state would be all that interested in continuing this process. And if we start to get information that individuals attended the game and they were sick and they passed it on to others, I'm sure that would be something that would be taken into account as we go forward. I know people were really excited when they came home and after the Denver game and the thousands of fans were there. I just kind of I heard about it, I looked at it and said, well, let's just hope there weren't a whole bunch of people there that were COVID-19 positive because they may have passed it on to other people. And that's always the biggest worry. I'm confident that when they do the testing, they're going to find positive people. I don't know how many, I don't know what percentage, but just based on the percentage of tests, including those that are asymptomatic, we are finding individuals who are asymptomatic who are testing positive. So I'm confident that people who buy the ticket, who will get tested, are going to come back and find out, even though they're feeling perfectly well, that they tested positive and they're not going to be allowed in the game. So that's why this pod system is put in place with less than 10% of the fans. The stadium seats over 70,000, a little over 6,000 are going to be able to attend. It's going to be very spaced out. The biggest concerns are not actually the seating, it's entry and exit, as well as kind of halftime when people mingle. Now it's going to be a lot different than a normal football game. There's going to be a lot more room in the concourses. It certainly will seem much more spacious than it ever did. And I've walked in there when there's hundreds of people, like doing construction work and something, and there's a lot of room, a lot of space, but it's a concern, and that's why the state is taking this as a plan that's also a one-time project that hopefully will continue once we win the wild card round and go into the divisional round. We'll go back down for one more round of questions. Jimmy Vielkein, Jimmy, do you have any more questions? Jimmy must be gone. Carolyn Thompson, Associated Press. Should I ask, is there any other media on from another outlet that I didn't identify? If not, WBEN? None. WBFO, Michael Desmond, you have any more questions?
Yeah. Is this kind of a test for potentially other sports teams?
It could be. It's a very complicated operation, and it would not be easy to replicate for any other team that actually has multiple games. If you're referring to the Buffalo Sabres, even though they're on a limited schedule, less than 60 games, we are talking about a system that is going to require every person who sets foot in that facility that has direct contact with the public, including the ticket holders, to get tested. That is not something that can be easily replicated for a number of games per week. It's possible, but it would require a tremendous operation that I'm not so certain even the Sabres organizations, once again owned by the Bagulas, are willing to entertain at this point. It is potentially being used as a plan for the future, but it also has a tremendous logistical operation associated with it, with lots of costs. And I think they're also going to look and determine, how did it go? Was it cost effective per se? I don't think it's going to be cost effective, and I doubt that they're going to want to do this on a 60-game basis for the Sabres if they know they're continuing to lose money. But they're going to play it by ear and see where it goes. Maki Becker, Buffalo News, any more questions? Spectrum News?
Yeah,
Go ahead.
I'm sorry.
Go ahead. Is that Maki? Or is it Spectrum News? I don't know who it is. Why don't we go back to WGRZ?
Can you hear me? I'm sorry.
I can hear you. Go ahead. Or not. I guess we're losing you. Channel 2, Leanne Stuck, are you still there?
This is Maki.
Maki, you're breaking in and out, and I think it's your phone. I don't think it's your line, our line here. Maki, are you there? Guess not.
Can you hear me now?
Yes, I can hear you. Go ahead.
Okay, sorry about that. I'm just curious, what are you most worried about with this scenario? It sounds like there are a lot of precautions being taken, but what do you think is, what's your number one concern? What's the most vulnerable point?
We're very worried about tailgating outside, because that's where small gatherings occur, especially on the private lots, which, as I noted, as of right now, have not received permits to actually perform the lot sales they normally would do, the parking. We're worried about people after the game not leaving. They're going to have to go to their car and immediately leave. They can't hang around and tailgate and things like that. We're also worried about how people react inside the stadium. Will will they be wearing masks? Will they attempt to subvert the rules that we have? And if they do, they're going to get thrown out of the stadium, but they're also going to put other people at risk. So I have not had a conversation with the sheriff's office today, but the sheriff's office has been involved with conversations we've had, including email threads recently about the actions that need to be taken. Our Department of Public Works and the sheriffs and others were involved in a conversation in the last couple of days with the Buffalo Bills on operations as if the game was going to happen. And I think everyone is just hopeful that people take this as an opportunity to enjoy the first home playoff game in 25 years in person and not an opportunity to be an idiot, because if they are, they're going to get thrown out of the facility and they're going to render the opportunity for this in the future to not happen, which would be sad if a few idiots basically ruin it for everyone else. Channel 2, Leanne Stuck.
Mark, I'm all set. Thank you.
Okay, thank you, Leanne. Chris Hervadas, Channel 4, are you still there?
I am. I understand that you have said, and you've made very clear, if you fail your test, the ticket is non-transferable. What about prior to the test? Is there any type of secondary market for season 6 ticket holders who do purchase a pod to then sell those tickets on the secondary market?
There is no secondary market. The ticket, because the individuals have to be identified when they purchase the tickets, when they put forth the purchase order. They have to identify who those individuals are, and those individuals are going to have to take the test, all of them, and pass it. And then when they come to the stadium, they are going to have to provide ID to show that, yes, if it's Joe Smith who applied for the ticket, got the ticket, then Joe Smith took a test, Joe Smith passed it, they're basically going to have 2 golden tickets. One, which is the ticket for the game. The second, which is the proof that they passed the test. And then they're going to have to show ID to a representative of the Bills organization who confirms it is Joe Smith who passed the test. And then Joe Smith will be allowed to go in and give their ticket to a ticket taker. So it's a very, very complicated process. And it is why I think it is one that can be safely done if all the parameters and protocols are followed, but there will be no secondary market. And if someone tried to sell a ticket that they got through the Bills on a secondary market, and that person tried to show up, even if they had something that said they passed a test they took elsewhere, they will not be allowed in the stadium. And the last question goes to Shannon Ross. Or, Ashley Rowe. Are you still there, Ashley? Guess not. So I want to thank everyone for all the work we've done lately to reduce our numbers. We have done better with regards to our COVID numbers. We were the worst in the state. We're now one of the best in the state. We want to keep it that way. I do not believe we will have a COVID-19 press conference tomorrow. We normally have them on Mondays and Thursdays. We are not going to do it because it is New Year's Eve, but I will be here, and we will be releasing data during the day, including the most recent mortality data. We get those on Tuesday evenings. Our Department of Health was working on that as throughout the day, and I truly expect any time now to get the most recent numbers. Once we have those, we will release it. So to all, considering in all likelihood I will not see you tomorrow, I wish everyone well. I hope you have a very happy New Year, a safe New Year. Do it safely so that we can all enjoy 2021. 2020 has been a very difficult year. Toughest year of my life, toughest year certainly of my county executive tenure. And to all the members of Erie County government, I want to thank you for all your great work that you've done, protecting the public, testing the public, the work that you do regardless of your department. It really has made a difference. And to the members of our community, thank you for all your support and your good work during a very difficult time. I know not everybody's happy about what we've been able to do these last few months, but by doing it, we're saving lives. And that's what it's about. It's about saving lives. So to all, may you have a happy and healthy New Year, and I will see you in 2021. Be safe and well.